gentlemen. My name is James Baldini. I want to thank you for coming. I'm a caregiver. I'm not a doctor. I'm a teacher. Three of the doctors in the room, two of them speaking, Dr. Janucci, Dr. Van Kasten, and Dr. Blanchard are three of our doctors that have really spearheaded this. But I'd like to take a few minutes of your time to talk about my daughter. Autoimmune encephalitis without an antibody has become a death sentence. And I don't mean to be dramatic in this statement, although it sounds it. For many, the outcomes are pretty clear. If you are seronegative autoimmune encephalitis, you are more likely to either die or have your life so altered that you can never expect to live a full and fulfilled life. It's a kind of death. You will be forever altered in your lifestyle. And if you show up with without an antibody, you face the real and ever-present, ever-likely possibility of rejection of treatment, to be labeled psychiatric. No antibody, no autoimmune encephalitis, no treatment. With that opening statement, I hope to drive home the seriousness of this and, at the same time, express my families and all those who have helped put this together the high level of appreciation we hold for you for having put aside your doubts and opened up your curiosity to this disease. And we thank you for coming out on this Saturday instead of spending this time with your family. We understand that sacrifice in a way that few could ever appreciate, as many of us will never have those same kind of moments with our family members. So thank you. I'm a teacher by trade, so please take notes and expect a short quiz at the end. This, by the way, is where the students in my class usually fall asleep. As a teacher of history, I have a unique view of my daughter's story. I have read up on instances where training hasn't caught up with the current knowledge of a subject. History is full of these stories. As an example, President Garfield, who died in 1881, actually died from sepsis from his physicians sticking their dirty, unwashed, and germ-covered fingers and instruments into his wounds. These doctors ignored the contemporary research. You see, standard medical practice at the time believed that the bloodier and more pus-covered wounds, smock, tools, and hands of the doctor, the better the surgeon. And at the time, the research done by Dr. Lister, the Dr. Dalmo of sepsis research, a little shout out to Dr. Dalmo over there, was nearly 20 years established. But this begs the question, why then couldn't these doctors see the necessity of Lister's approach? I have the answer for you. This kind of thinking was what we faced at the hospital, a la Harry Potter, whose name shall not be spoken. In fact, the phrase standard medical practice was used several times against ARIA. The AE Alliance website, as well as research articles from Dr. Dalmo, Dr. Najjar, and Dr. Lancaster, and others, flew directly into the face of those who continued to use that legalistic phrase. They knew about this research as we gave everyone a copy of the literature, including patient advocacy, the doctors on the psych wing, and anyone who would be willing to take it. In the audience today, Dr. Jenny Blanchard, who a 25-year psychiatrist, tried repeatedly to inform the hospital as well as the court system that had ordered Daria's incarceration. Dr. Blanchard also tried to explain to them that the antipsychotics weren't going to help Daria. As she said, I quote, "If it was psychiatric, she would have responded to meds, especially during the first break. This is how I know it's not psychiatric," end quote. As to the lack of an antibody, the facts from our experience and those who have been in contact with us is the same around the world in regards to patients who are seronegative. No antibody, no autoimmune encephalitis, no treatment. Or to use the historical reference, seronegative need not apply. I stand before you, though, as a failure. The one single most important job of a parent is to protect their child, and I failed to do that. I failed to stop the bad man from underneath her bed from hurting her. The boogeyman got her. When she begged me to get her out of the hospital, and she did, the hospital that had kept her for 75 days, I couldn't. When I saw the joy in which they took in holding her down and restraining her, all I could do was complain. When I saw them treating her for a disease she didn't have, our pleas and complaints, use of their internal checks and balances fell on deaf ears. We failed. and today I live with that failure. Every night I'm reminded of my failure as I kiss my daughter good night. Sometimes I'm greeted by a stone mask of a face that doesn't respond. Other times by her eyes following me, and sometimes I get a kiss back on my cheek or the occasional hug as this disease waxes and wanes through her system. On a really good day, she'll say something like, "Dad, can you fix Daria's world?" In a video of her later, you will have the opportunity to hear one of her bad days as this disease attacks her brain. For now, we have a routine. Daria starts at around 4:30 in the morning. There's a contrast here that I can't avoid. I would often get up on the weekends to start her car and get her a cup of coffee in the morning before she ran out to work at the bagel place, her part-time job. Today, instead of filling her with coffee, now I fill her with meds and supplements that we hope get her better. It's a painful experience emotionally as well as physically, as oftentimes I'm reminded of how I'm getting older and wonder who will take care of Daria when we are gone. Another future failure for me to worry about. But as Al Pacino said in Scent of a Woman, there's nothing like the sight of an amputated spirit. There's no prosthetic for that. Every morning I see my daughter's amputated spirit ripped from her because of people we trusted violated that trust. Individuals who should have known better didn't do the right thing. Tomorrow morning when you get up, whatever the time you get up, you can think about how you have looked forward to your day as I look forward to what will inevitably be another failure of mine. While you are going about your day, know that there is a young woman who's trapped within her mind, fighting to get out, and that the reason why she is trapped isn't just because of my failure, but because others did her wrong. The two major institutions that our daughter had the misfortune to interact with believe this simple phrase, no antibody, no treatment. And with that simple statement, not only did Daria not get immediate treatment, she got the reverse, a changed diagnosis to psychiatric. And this was done with little or no explanation, but sorry, that is actually incorrect. There was an explanation. One psychiatrist, a doctor at the hospital that shall not be named, said, in many cases, the best answer is the most obvious answer. In this case, your daughter is a young woman of 21 in 2014 when she first presented as psychiatric, who was under large amounts of stress at college and simply broke. It is most common among women of this age. End quote. To be sure, this doctor, also a young woman herself, didn't seem to notice that by 2014, Daria was already in her fourth year of college at Amherst. This doctor didn't take any stock in Daria's teratoma, nor the improvement, dramatic improvement after its removal for that matter, the negative impact that psychotropic drugs had on Daria in the 75 days that she was there with them. And despite evidence from Dr. Jenny Blanchard's treatment plan in which psychotropic after psychotropic caused Daria's behavior to worsen. But again, the easiest answer is often the best answer. And I understand that this is taught in medical schools so that doctors don't run down blind alleys in the mistaken hope of finding a rare disease. Yet here we are. A rare disease that is turning out to be not so rare. Daria's diagnosis was made by a judgment call. And during one of our conversations with the administration, Samime, my wife, asked a valid question to the director of medicine. What blood test did you do to determine that Daria was psychiatric? The answer, as many of you already know, is none. There is no blood test to determine psychiatric. In conclusion, I would like to leave you with this. America needs you. Our loved ones need you. Our world needs you. This disease is growing in prominence. It's not going away. It's becoming increasingly clear that this disease is destroying families and our loved ones' lives with its destruction. We need a clinic dedicated to autoimmune encephalitis regardless of antibody, a center that is a cross between psychiatric and neurological, as this symposium is. A center with trained staff in crisis management, as both Samime and I have been from our years in behavioral setting. A center that has doctors who are willing to treat regardless of antibody, where blood work, treatments, and other necessities can be dealt with in a controlled environment. Our house in the woods of Sussex County is a saving grace for us as our neighbors cannot hear Daria screaming at the imaginary people in the room. Our neighbors don't get upset when she attacks the wall or when unmentionable liquids leak through the floor. This future center needs this isolation, as many outside this community don't have a full grasp of just how difficult this disease is. This center should also allow for families to be on the premises. This disease is not psychiatric, but families that are willing to help should be involved, caring for their child. Most of the time, diarrhea isn't dangerous, as someone who is psychiatric, and family involvement is a necessity for loved ones to get better. It improves their chances when so much is already stacked against them. Besides, I wouldn't want a stranger showering my daughter, and that's Samime's thing. By the way, that's something else that diarrhea can't do on her own. The burdens of families is enormous. There's just Samime and me for diarrhea. The two of us are the front line, the reserves, and the home front. There's no one else we would subject to this pain who wasn't a trained professional. Earlier treatment is essential, and a clinic that can do that won't have any more victims like our daughter, a victim of this disease, bad medical practice, and a failure of early intervention. Thank you for time, and remember your time, and remember, tomorrow morning when you get up, you have a future. Our Darias and those like her have a future in doubt. And I always like to end the phrase with Invictus Mineo, which, by the way, means I remain unbroken, unvanquished.